Okay, good evening, good afternoon, good night, and good morning to all our colleagues from all over the place. I would like to welcome you all in this very important program, the Eminent Speaker Series. Today is a very special day where we will be learning a lot of issues concerning the pharmaceutical and the situation in Africa during these difficult times. Before, I would like to welcome also my colleague Shilpa Razal, who will be moderating this evening. And also I want to welcome Dr. Skhumbuzo for his time, for his presence, and I'm sure we will be learning a lot of things today about the pharmaceutical industry. On behalf of the Staff Council, I would like to thank you all for your time and for your presence. And I'm sure you have fun today. And yeah, that's it. May I pass the microphone to Shilpa to take over, and welcome, Shilpa.
Thank you so much, Hassan, for this opportunity. I really look forward to this, and I'm sure we will have a great session today. Warm welcome to each and every one of you, and thank you so much for making the time to join us today as we discuss this important topic on African pharmaceutical industry and the lessons, of course, in the current context of the pandemic of COVID-19. Before we get on, I'd like to just quickly mention some house rules. Please be, you must have joined on mute, and you will be muted throughout the meeting. Make sure your microphone is muted in case, in order to not to interrupt the speaker. Before and when you're starting to speak, please introduce yourself, identify yourself so that we know who is talking. And please bear with us as we speak with colleagues from across the world today. And this may entail that you may have to speak a little slowly and clearly so that everyone can, can hear you over the meeting. Please do not, crosstalk over the other speaker. Please let everyone finish. If something is unclear for you during the presentation, please feel free to put your questions in the chat box, and we will get to the questions in the chat box as we make the session more interactive. To make the session more interactive for everybody, we have the tool called Mentimeter. You must see on the slide on your screens the code that you can use once you go on menti.com, so that you can answer all the interesting questions we have there. We have some polls coming up. We have some interesting data that we would like to get from today's discussion. Then that's it from my side. I will just quickly introduce Dr. Skhumbuzo, and then we will give the floor to him without any further ado. Dr. Skhu is the CEO of Kiara Health. It's a South African healthcare company, and he is extremely passionate about development of African pharmaceutical industry. He has to try to ensure the access to the quality assured medicines to the masses, and he has made significant contributions in developing the pharma industry in the country. He has worked with both private and global public health organizations. He has consulted to numerous multilateral organizations as well, like WHO, UNIDO, and other US-based organizations. And he's an author to multiple publications that extensively speak about the state of current African pharma industry, its future, and is a key figure at international conferences, as he's a key stakeholder to engage with. Welcome, Dr. Skhu, and we look forward to hearing your inputs on today's session. Before we get on, Stephen, can we quickly run the first two questions on Menti? So let's find out where we are joining from today. I'm sure we have colleagues from across the world. So if you all can please go to menti.com, put the code 79382026. You'll be able to see the poll. on your screens? Great, we have started getting the answers. Excellent. Let's give some more time for everybody to log into Menti, as this is our first question. A few more answers, come on. Great, thank you so much for sharing your location information with us, as we are joining mostly from Europe. Oh, okay, I see some answers from Africa as well. Excellent, okay. Interesting, someone in Spain as well. Thank you. Thank you for joining us today, and we hope we all have a really interactive session today. Stephen, can we move on to this next question, please? Yeah. So everybody, what do you think will most likely determine the national stability in the future? There are some options there. You can select what you think is right, is the most important factor. Interesting results. Okay. Okay, we see a close competition here between the GDP and wealth and in medicine. Interesting. Yes, we would naturally hope that the GDP and the wealth in the hands of common people is one of the most significant factors to the national stability. And of course, there is no right or wrong answer, but yeah, this just helps us to get a perspective on what everybody's thinking as of now. Great. Moving on, I open floor to Dr. Skhu. We look forward to hearing you. Thank you.
Thank you so much, Shilpa. I really appreciate it. And I think let me first start by thanking the organizers, Hassan. It's a privilege to be part of this very important event and group of, I guess, talks that address some critical issues. And I think it's quite encouraging to see, again, important organizations like UNIDO, putting these things to the fore and making sure that there's, a discussion, debate, discourse around these critical issues. I think, as you mentioned, I had the privilege of, consulting for UNIDO in the past on the development of the pharmaceutical manufacturing plan for Africa, working with the African Union Commission and UNIDO. So in a way, it feels like one is, home in a way. So I think I'll go on to the first slide. I think I've been introduced, and I thought it was important just to begin, before I talk about the topic, just to frame the debate. Because the issue of access to medicines in Africa is not a new issue. It's been discussed. It's been, I'll use the word loosely, tortured over the last 2 decades or so. And we are no closer to a solution, right? We've had some really prophetic statements that have challenged the political leadership on the continent to take a different look at this and to put in place different solutions. I think one of the most powerful statement in this regard was made by the former executive director of UNAIDS, who was a great supporter of the local production agenda. Michel Sidibe, when he addressed the heads of state, African heads of state and government in Abuja, Nigeria. And he basically said, and I quote, "In the future, regional and global power and national stability will be determined not by who controls access to arms, but by who controls access to medicines." On the face of it, it looks like a very superficial and maybe even dramatic statement. But I think there have been developments, especially COVID, that have shown us how true this is. And we saw it when global supply chains broke down. We saw it when countries restricted exports of medicines. And we saw what that led to in some countries and some regions of the world. If you could go on to the next one, please, Stephen. I had the opportunity to work with USP on a couple of publications, including a thought leadership paper. And one of the statements I had made then, and this is 2018, unbeknown to us, we'd have COVID hardly a year or so later. I had made the statement that the biggest threat to the supply of, these critical medicines is from, pandemics such as Ebola and MERS and SARS and the pandemic flu. And I made that statement very acutely aware that in 2009, when we had the pandemic flu and countries were buying Tamiflu, Africa and some of the developing world were basically shut out as the more, the wealthier nations hoarded stock, and people in Africa and of course other developing nations were left out. You see this play out year after year with the flu vaccines. You've seen it play out when we had, for example, Cyclone Harbat in India that destroyed the API plants of a number of critical suppliers of ARVs. We saw it play out, of course, when the Beijing Olympics came and the government shut down the suppliers of intermediates. Every time there's one of these shocks, there's a security of supply issue in many parts of the world, including Africa, especially. If you can go on to the next one, please. There's a famous African saying, which I've quoted ad infinitum at conferences whenever we talk about local production. And some of us who've been advocates of this have consistently said to the powers that be that you need to start building now before you have to build in the middle of a real crisis. And of course, that African saying, which I refer to and I've quoted consistently, says that, and truly so, that only a fool would want to build a shield in the middle of the battle. And to a certain extent, I think we found ourselves caught with our pants down when COVID hit, because again, as I said, we know global supply chains broke down. We know that countries restricted exports, and African countries, unfortunately, because of limited buying power, because of their lesser strategic importance, and a host of other reasons, literally found themselves at the back of the queue in accessing critical medicines and medical supplies. If you look at what happened with ventilators, I mean, when COVID hit, with a continent with 55 countries had less than 6,000 ventilators. Of course, some people say it was closer to 10,000. Whatever the actual number was, the supplies or the available number of ventilators was hopelessly inadequate to respond to the needs of the people. And when countries tried to buy on the global market, they found themselves competing with the city of New York and this country and that country, and again at the back of the queue. Which brings me to the point that I wanted to make, to say, one of the things that COVID has done is to expose what, in my view, borders on reckless behavior in the past by many governments, by many procurement officials who basically put in place policies that excluded local capacity, local capability building, local manufacturers, meaning that entire countries and entire continent was literally dependent on external supplies for critical products. And to give effect to that, I'll give you a simple example of a country like South Africa. South Africa was a nuclear power. The first heart transplant happened in this country. And yet when COVID hit, the country came within weeks, maybe 2-3 months of running out of paracetamol, which is a very simple molecule to make. Can I have the next slide, please? And so with this, I thought, let me just give you, oh, sorry, I think I have to pause, and there are two other questions from the Mentimeter that are there. I think this one we'd already done. Maybe if you go on to number 3. Okay, according to you, what is the biggest threat to health and medicine supply or medicine security of any country? There are a number of things that have been mentioned there for possible answers. If you could please go on and log your answers, then we'll move on after the next question.
I think, Dr. Skhu, you mentioned really an important point as to how the past shortcomings have been exposed during this pandemic hit. And I think the pandemic has basically shaped the whole point of view for so many people and for so many governments that were operating across the globe in the past few months, past 2 years. So I think these will be really interesting insights coming up in this one and the next question. Please be interactive. We would like to see some more votes, and we would like to have some discussion on this as we go along. We will of course have a question answer session at the end of the presentation, but if you have any other questions that you would like to ask to Dr. Skhu, please put those questions in the chat box, and we'll be happy to get to them as we go along. Thank you. Let's move on to okay, very interesting insights here. People thinking that pandemics and commercialization have been equally strong threats to the medicine security. Interesting. Stephen, let's move on to the next question. Sorry. Everyone could please just rank the shortcomings that they think the countries have faced during this pandemic. What do you think had the most impact in the countries? Were there shortages of test facilities? Were there several roadblocks that countries experienced because the supply chains suddenly stopped? There were constant changes in the quarantine requirements. The ships were stuck in the sea. There were no supplies coming in. Mm-hmm. Interesting how the disproportionate distribution of wealth has also impacted the pandemic in this difficult times is also an important thing to keep in mind. Very interesting, very interesting. You will just have to move the options up and down in order to rank them on menti.com in accordance to your significance of impact. Excellent. We have some significant answers here. Great, Stephen. I think we can move on to the presentation. Dr. Skhu, over to you, please.
Thank you. So I thought I'd just give a very high-level overview of some of the challenges that the continent is facing. And as I take you through this, it's important to understand that even with these very stark figures, very little had been done until very recently to try and build the internal capability to deal with the issues. So if you just look at the global burden of disease, I mean, 25% of the global burden of disease is in Africa, which accounts for just over 12% of the global population, 3% of the world's healthcare workers, but you have 75% of the global HIV/AIDS burden. You have about 23 million people now on treatment for ARVs, not a single API facility on the continent, 90% of the ARVs that are in use in the continent, all imported. You've got about 90% of the malaria cases and deaths. Again, tragically, no API production, perhaps except Pharmaceutical in the DRC, which does quinine API. The bulk of the API is imported, and there are some formulators, of course, but not enough. And then you have 9 out of the 22 countries globally with the highest TB burden. Now in Africa, again, no API production, although CPT in South Africa is about to start. We have significant maternal and child healthcare mortality, but if you look at the simple products that are needed to treat this, your oxytocins, your magnesium sulfates, that, again, very few suppliers from the continent. Then, of course, we are sitting on a time bomb of non-communicable diseases, cardiovascular, hypertension. It's now around 150 million people with hypertension. If you look at WHO Afro figures, almost 20 million diabetics, more than 1 million new cases of cancer. I think 1 or 2, or maybe less than 5 companies that produce cancer drugs. And on top of this, the continent is sitting on a silent epidemic. And this is, of course, the scourge of substandard and falsified drugs, which in my view and the views of many people are killing more Africans than HIV, TB, malaria probably combined. Can you move on to the next slide? And of course, as these things happen, you are having a change in disease profile. We are seeing as the continent becomes more prosperous. Of course, COVID has sort of put a bit of a halt to some of this incredible progress that we saw. But as the continent becomes more prosperous, as people become able to afford, and you see the introduction of national or social or community health insurance across many countries, we are now having to deal with a different set of challenges, lifestyle diseases which are difficult to treat, which are chronic, which require more medicines and all of that. Again, with all of this happening, very limited development of the pharma sector to keep up with these challenges. On top of that, if you look from a government perspective, because most people still depend on governments for their healthcare, governments are operating with constrained health budgets. The infrastructure is typically still very archaic, very centralized, which means if you live in some rural village in many countries, you probably have to travel 400 or 500 kilometers to access specialist care, which makes it difficult for people to do that and leads to poor outcomes. I've mentioned the issue of substandard and falsified drugs. And of course, one of the biggest challenges, and which has been an impediment to the development of the pharma sector on the continent, is the fact that your procurement systems are very opaque and lend themselves to corruption in many instances. With all of these things happening, you have the global public healthcare community coming in to support, but the tragedy is most of the funding mechanisms crowd out your local manufacturers. I mean, I understand the issue of quality, and that's sacrosanct and it should never be compromised, but global public healthcare funding mechanisms have never bothered in the last 10, 15 years to put in place systems that say, if you're a local player and you meet the requisite standards, this is the support that you'll give, even if you are slightly more expensive. And that is fundamentally from, I guess, a global view that looks at aid as an opportunity, I always say cynically, to provide employment for people maybe from the West, whatever. The only good aid is aid that works itself out of a job. And when it comes to procurement and global public healthcare issues, the aid we've seen is one that keeps the continent specifically dependent in perpetuity on others. And I think that is very, very wrong. With all of that in mind, the out-of-pocket expenditure for Africans on medicines is in the region of 60 to 70%, depending on countries, which is clearly not a tenable or sustainable issue. If we could move on to the next slide, please. So just looking at the size of the market, in 2010, IMS Health, which is now called IQVIA, had pegged the market at around $14 billion, with a prediction that it would reach about 30 billion by 2016. These figures were then reforecasted, and the prediction was by both the IMS or IQVIA and McKinsey, Frost and Sullivan and others that the market would reach somewhere between 45 and $60 billion. So it's a sizable market. And I think if the willingness was there to substantially invest, local companies would also have a significant, market to compete in. what is currently happening, as I said, is 70 to 90% of the products that are used on the continent are imported. 95% of the APIs are fully imported, mostly from India and China. There are some excellent companies in both countries, but there are also low-tier companies or some other players who bring in products that might be of dubious quality, which gives the great companies that are there a bad name. And I think that's unfortunate for everyone. That needs to be dealt with. If you look at the continent, they're in the region of about 750 manufacturers. There are about 5 or 6 that have either WHO or USFDA. There are a lot more companies that are operating at international standard, for example, in places like South Africa, Kenya, whatever, but they have not, because of the product range, gone for these international quality systems, which lends itself to a very false interpretation that it means that manufacturing in Africa is not at the requisite quality. Of course, the one thing is, the pharma market on the continent is growing quite substantially. A country like Ethiopia, which is seeing significant growth and investments in their sector, especially at the Kilinto Pharma Park, where you've had close to $1 billion now in new investments from Chinese companies and whatnot, is growing at about 25% per annum, and primarily driven by the incredible support that the government gives to local manufacturing. It's a whole lot of incentives that are there to make sure that they promote local manufacturing, and they attract FDI, which is a crucial element, obviously, to developing the sector. Can you move on to the next slide? So with that in mind, what has been the impact of COVID-19 on supply to Africa? We touched on it in the beginning. We've seen a shortage of critical medicines, as we've already said. There was a breakdown of global supply chains, there was price gouging, there were export restrictions, and the prices of some raw materials tripled or quadrupled overnight. I mean, I remember when chloroquine was the rage when COVID started. The price of chloroquine went from something like $50 a kilo to more than $300, $400, in some instances. Of course, outside of the COVID and the related medicines or the other essential priority medicines, there was a delay in diagnosis across many African continents because we couldn't access, the diagnostic reagents, the PCR. I mean, swabs, which is nothing but a ball of cotton wool. We had a shortage of that, and that meant that we couldn't diagnose people quickly enough. People who were suspected of having COVID were still going around clearly spreading it because they had not been diagnosed. So there was an impact in that as well. We saw poor outcomes in many hospitals, largely because there was a shortage of oxygen, there was shortages of ventilators, both the non-invasive as well as the invasive, and even simple things like CPAP. And again, I always say, in the middle of adversity lies opportunity. Because of a shortage of ventilators, we saw at least 5 countries on the continent almost overnight develop local solutions. The National Ventilator Project in South Africa led to about 16 different innovations, 4 devices made it to the market. Students at Nairobi University in Kenya developed a ventilator in double quick time, which was approved and registered and is working very well. In Nigeria, similar things. So the innovation potential came through, and because governments were desperate and had nowhere to go, they had to support these local guys. And we've seen people coming up with either serology tests or antigen tests or even PCR to be able to diagnose. But the impact was, in the beginning, we didn't have enough, and there was a delayed diagnosis, which clearly lent itself to quicker spread of infection and poor outcomes. The one thing that it's been spoken about, but perhaps not enough, is the negative impact on other common conditions. Because hospitals were largely closed off to anybody but COVID patients, and emergencies and clinics were largely closed off, the normal, day-to-day conditions that are seen, whether it's TB or heart hypertension or diabetes and depression, that care suffered as a result. And I think one thing that would be interesting to look at, of course, is the rising incidence in new TB cases, for example, the rising incidence in MDR, XDR, and of course, the rising number of suicides. I've seen in some literature that some places certainly saw an increase in suicide rates because of the related depression and isolation and anxiety and all of that. But of course, this thing was happening where people were not able to freely access healthcare. The economic and social impact cannot be, understated. If you are in Africa, if you live in a village where there was no access to the internet and electricity and computers and whatnot, it means that you lost months and months of education. So there's a generation that has been severely impacted. And of course, we'll see the real results of that on countries in the next 10 to 15 years. Economically, companies shut down, there were retrenchments. Can you move on to the next one? I'm conscious of time.
At this point, I'd just like to take this quick question from, have some answers coming in from the participants to identify the biggest opportunities on the continent in this new normal world that we are seeing post-COVID. As you rightly mentioned, this was some staggering statistics we saw, right? In terms of how many local solutions were how quickly deployed in the countries and to fight the pandemic, to combat the diseases that were identified, and while we had no information as such about this. So I think let's hear from the participants as to what could be the next biggest opportunity for the African countries to tap into as we are slowly trying to come out of this pandemic. Interesting. I'd like to encourage some participation from the participants. Let's get some really interesting ideas thrown around here. Excellent. Okay. Yeah, the self-sufficiency of the countries in order to build their own, technologies, to develop their own medicines and facilities, I think has been one of the key change makers in the countries. We have seen similar trends in India. Personally, for me, I mean, I was stuck in India while the pandemic was going on, and I've seen some, small town innovative people coming together and developing some solutions for the market that was so important for this. Great. Okay. Yes, I think research and innovation, combining it with technology, I think is one of the most important factor we see here. Stephen, let's move on to the next question, please. I'm just conscious of time here. We still have to get to some interactive questions. So I'd like to ask the participants, how could UNIDO be more supportive, more encouraging in the local industry? What do you think UNIDO can do more in these areas where technology transfer, skill development? I think they are all equally important, aren't they? As to okay. We see more answers coming in, and technology transfer and skill development is the most important. Okay. What do you think, Dr. Skhu, how the technology transfer in the last few years have you seen in the African continent? I think let's get to that question as we go on to the end of the presentation.
Yeah.
Great,
look,
let's move on then.
Okay. Do you want me to answer or move on to the next slide?
I'm very happy to hear your answer at this point, if you please.
Look, there clearly has been some tech transfer, and it's been transformational for the companies that have received this tech transfer. One of the greatest successes is Aspen Pharmacare, which is now in the top 10 generic companies in the world. Started out as a mid-sized South African player, in the late 90s. It's now, as I say, in the top 10, multi-billion-dollar operation in about 134 countries. And it's largely on the back of the technology transfer deals that were struck with companies like Eli Lilly, MSD, GSK. And in the process of doing all of that, Aspen acquired competencies and capabilities he didn't have before. This opened up international markets. And what was a South African company with SAPRA registration is now a global company in 134 countries with plants approved by FDA, EMA, TGA, Health Canada, very transformational. A company I'm associated with is Biovac, which is a vaccine manufacturer. I chair the board. Biovac has been the recipient of tech transfer from Sanofi for the Hexaxin vaccine, which we are now producing successfully. We've also been the recipients of pneumococcal vaccine tech transfer from Pfizer, which we are also now going to start commercial production of. And of course, the COVID vaccine, there's some work going on with Pfizer. So tech transfer is transformational. And I would say that's an area that a lot of emphasis needs to be put into, because it's not only the technology, it's the know-how, it's the skills, tacit and hidden. So there's a lot that can be done from tech transfer, and it's possibly one of the areas I think I agree where UNIDO can also put a lot of effort and emphasis.
Right, our participants have rightly voted in them. Let's move on to the next bit, please.
So I think in terms of then going forward, building capacity to respond not only to COVID, but to other potential pandemics in the future, I think it's critically important to build the local manufacturing base and to build local capability. This cannot be done in a vacuum. You need to look at issues of policy alignment across the different ministries. You need to look at things like funding and incentives, innovation, regulation, procurement. And I think it's worth saying that I mentioned the PMPA at the beginning. UNIDO played a very crucial role in the development of the PMPA. And I think if you look at the number of measures across the continent, number of companies, numbers of people employed, economic value added from the pharma industry, you'll see there's a hook after the 2011-2012 adoption of the PMPA. You can see that there was an impact in that. And subsequent to the PMPA, a number of countries started adopting their own pharmaceutical policies and strategies, Ethiopia, Ghana, Nigeria, Kenya. And again, UNIDO played a role in some of those. I think this is something that needs to be intensified. We've seen its success, whether it's the GMP roadmap process, whether it's on the assisting with policies and strategies. It's something that has borne fruit and I think needs to be encouraged. As I mentioned, what we know, of course, is, pre-COVID, after COVID, there have already been a number of manufacturers across the region. They need to be supported to acquire international GMP where that is not available. We need to be able to get into a place where we can utilize the significant idle capacity that is available to be able to meet at least the supply of essential medicines. I think technology transfer we've already spoken about. I think we also need to look at global procurement mechanisms and how they can put in place policies that do not lock out local players. I'll give a very simple example. There are some local entities that have developed rapid antigen tests, serology tests, PCR, tests and all of that. But the refrain that they get from all governments, even though this have been validated locally against, your traditional PCR in local labs, reputable labs, most governments in the region will say, if it's not WHO approved, we are not touching it. I think it's a tragedy and we need to look at that. And even if it means that organizations such as WHO have to either assist these companies, get them approved quickly, or create an alternative pathway that qualifies quality products that are produced locally. Can we move on to the next one? I think funding is a key issue. The pharma industry is a very capital intensive industry. And of course, unlike most industries, you invest today, you probably start reaping the rewards after 2 years because you have to qualify, validate before you can go onto the market. So funding is a crucial element. And I think what needs to happen is, one, governments need to put in place the necessary incentive schemes and programs, but they also need to use local procurement as a financial asset for local companies. What does one mean? If you're going to cover aside a portion of what you procure for local companies, especially if you give them long-term framework contracts and all of that, they are able then to plan better and to raise funding against government contracts and all of that, to build capability to procure at bigger volumes, at better prices and all of that. We need to look at our regulatory systems and make them more responsive. We need to reform procurement systems. I've already mentioned that. We need to look at some issues such as pooling of procurement of critical raw materials. This is an industry issue per se, but I think, one that has the potential for significant impact if it's done, if we can get our companies to cooperate on that. HR development and building of local capacity is key. Again, institutions like UNIDO have supported, say, LUCs and other initiatives that sought to develop local, capability, regulatory, drug development, and all of that. And it has to be intensified. And there has to be a very urgent, I'll call it an urgent need to address local procurement mechanisms and the unintended consequence of putting quality, which is crucial and sacrosanct, and sort of counterbalancing that with the need to support local companies, because then the fact that you're not WHO, your products are not WHO pre-qualified does not hold that you don't manufacture at quality. The process of accessing that WHO pre-qualification might be a challenge financially or logistically or from an expertise point of view. So we need to find a way to make it easy for local companies to get access to such initiatives in order to be able to supply their funded markets. If we can move on to the next one. The one thing that has been missing, and people always, dance around this issue, but we need to call a spade a spade. There has been a lack of political leadership when it comes to supporting local production on the continent. If you look at countries that have successfully traversed this, whether it is India, whether it is Russia, whether it is Bangladesh, every single one of them, Algeria, Tunisia, every single one of them started with a deliberate intent, and it started right from the top. That's one thing that's needed. I think African countries and African institutions need to lobby the international community again to address the issues I mentioned around getting their companies into this, lists that qualify for procurement. We urgently need to build and broaden the industrial base. Whilst we have multiple companies with billions of capacity for oral solid dosage forms and thousands and thousands, hundreds and thousands of liters of liquids and gels and this and that, on the injectable side and steriles, there's still room to move. Vaccines is a case in point where we're now talking of a continent of 1.3 billion people, less than 2% vaccinated because the capability is not there. We need to basically encourage industry, academia, research, institute partnerships, especially to look at integrating backwards into critical APIs and into things like vaccines. And I think what also needs to happen is a metanoia of sort, a fundamental change of mind where people understand that health is not an expense, health is an investment, health is a key driver of economic growth. Most of the procurement agencies or bodies on the continent normally see expenditure on health as nothing but a cost. They don't see the benefit and how it can drive industrialization, industrial growth, how it can contribute to, an entry into the knowledge economy by putting pressure on the educational system and all of that. And I think there has to be some work on that. And then the last point on this slide is really around supporting and nurturing local innovation. As I said, one of the things that gave us great joy around this terrible COVID pandemic is to see the significant innovation capability that is available on the continent. I mentioned countries that developed ventilators. Many people don't know this. I said in Kenya, it was a group of 15 students, medical and pharmacy and engineering students, who developed a ventilator. In Nigeria, a second-year mechanical engineering student designed, developed an incredible non-invasive ventilator. The capacity is there, but these people need to be supported. They need to get funding, and they need to be exposed so that, you know, investors and whatnot can come through. If we can move on to the next slide. So with that, I think, and as I move to a close, I would say, you know, COVID has exposed many weaknesses in Africa. It's been a time of pain and suffering. Companies have shut down, people have been retrenched, lives have been lost. But again, and I quote Einstein here, in the middle of difficulty lies opportunity. Out of this pain, we can create something that will at least make sure that when the next COVID comes, whatever it will be called, we'll be better prepared. So it's time for the continent to take steps to allow local manufacturers to step up, to develop new capabilities. It's time we fast-track the development of or the adoption and implementation of the African Medicines Agency and harmonized regulation across the continent. It's time that we fast-track the registrations by local companies to give them an edge in the market or earlier entry. And it's time that we relook our procurement to be able to support local companies, because unless you have a captive local market, it's going to be very difficult to compete outside. And it's time we relook things like the policies that govern this industry, the funding instruments that are available. And it's time we use instruments like after the free trade agreement to really promote intra-Africa trade and remove these silly tariffs that are preventing this across the continent. And of course, it's time that the African institutions lobby hard to organizations like UNIDO, which has done excellent work. And I've just seen under the participants, Alista, who we worked with on the pharmaceutical manufacturing plan is on the program. Good work has already been done. A track record has been built. The GMP roadmap program in Kenya, in Ethiopia, the work with ECOWAS, this needs to be intensified because it has borne fruit, it has shown its utility, and I think it needs to be increased. And then I think one area that UNIDO as an industrialization-related organization really need to look at is the issue of technology transfer. I mean, there are other players, I guess, in the UN family, but this is about industrialization and healthcare, and maybe knowing what technology transfer can do, whether it's in agriculture, whether it's in energy, whatever. This is probably an area where UNIDO maybe might decide to take a different look and say, let's put a team together, let's play the honest broker role, get companies from Africa, get companies from the West and from Asia that are willing to engage and drive this so that we build the capability and the capacity that Africa needs to respond to the health challenges of the future. I think there's one more, and then I'll pause there. I'm acutely aware that we are running out of time. So the next one, I think it's a Q&A, and then, yeah, that's it from me. So I end with Michel Sidibe. I started with him again. Oh, sorry, there's another.
I think Dr. Skhu rightly identified that the local innovations were the saviors for most of the countries across the world. That's the newest trend that the countries have seen, how local innovations were important. And now, of course, UNIDO has a significant presence in Africa and has many, really important projects going on on the continent. I'd now like to just invite our participants to participate in this poll so that we get an understanding as to what according to our participants, is the next step that the African countries must take right now for the security of supply. I think skill development is one of the significant things coming out of all our discussions, Dr. Sku, if you've noted. Along with technology transfers, the skill development locally has, has been important. And of course, countries have found it. Some governments have really found ways to expedite the local manufacturing by allowing expedited registrations, expedited entry to the market in light of the pandemic, in light of the need of the hour, etc. And I think that this rightly points out by the answers that our participants are giving here. I'd like to now open the floor to the questions from the participants. And I'd like to ask the participants to please post your questions in the chat box so that we can ask Dr. Sku about his expert opinion. Meanwhile, I read a question from Hassan. He wanted to know what was the situation before pandemic? How was it before pandemic, and how is it now that we are getting slowly out of the pandemic?
Yeah, so the situation before, and I'll speak from a local pharmaceutical manufacturing perspective, local companies were really getting a look in. It was difficult to compete, price, and a host of other issues. Of course, when COVID then hit, and because of the challenges that we've already spoken about, breakdown of global supply chains and product hoarding and price gouging and all of that, everybody turned to these local companies. They suddenly wanted to be supplied with all the products that they needed. And the challenge was these companies couldn't access the APIs. The challenge was, some of these companies were owed months and months of supply. And it was a difficult situation for everybody, right? Having said that, I think the situation before, local manufacturing wasn't seriously considered. After, I think there's been a significant shift in the mindsets of many governments and procurement people, because at the end of the day, most of them had nothing to fall back on but the local manufacturers. One, two, they realized the peril that we'd been warning them of, to say, if you don't do this, this is what will happen. We saw it in real time. Countries like South Africa, as I said, former nuclear power, the country that pioneered coal to fuel technology, one can go on and on, came very close to running out of paracetamol, one of the simplest molecules to manufacture. And clearly, it's not a case of the know-how is not there. It is simply a question of even those who have the know-how will not be supported because the focus is on buying the cheapest product and not supporting local industry. So if I had to summarize it, I would say the situation before COVID was local manufacturers were nothing but like a poor orphan. Now they've become, more important and more critical. And I'm hoping that it won't be a COVID-related, I'm hoping that we won't have a schizophrenic view once COVID goes, whenever it goes, whether it's 7 years, 10 years, it's anybody's guess. I'm hoping that governments and procurement agencies will not default back to the old position where they ignore local capacity, because if we do, I think the next time the next pandemic comes or some other shock, there will be no excuse to anyone.
Of course, this has been an eye-opening 2 years period for, I think, for the continent as a whole, I think, and this is a very very important message that we can take, that we need to be prepared, and we can only be prepared before the battle begins and not in the middle of the battle. As you rightly started with that quote, you cannot really start building a shield in the middle of the battle. So I think this is a really significant lesson that we take out of today's session. Do we have any more questions? We do actually. We have one question in the chat box. Do you see any tangible mindset change from African leadership in viewing pharma from being a health problem to an economic opportunity, similar to what India, China, and the West have done in the past 30, 40 years? So do you think the economic opportunity has been highlighted during this pandemic in the on the continent?
No, absolutely. And I think there are a number of reasons why that is the case. I think on the one hand, there was a simple realization that you'd rather pay a premium of 10 or 15% on a regular basis than have to pay a premium of 500% when you have these shocks, especially when you don't know how long these shocks will last. The second realization, of course, is if you look across the continent, many countries have had significant job losses. I mean, in some regions, 1 million plus, jobs shed overnight. So governments are looking for anything that will create, new employment. I think the third reason, it was a realization that local manufacturing is not as bad as it was made out to be, and I'm talking from a price competitiveness position. So I'll give you a very simple example with South Africa. A lot of our PPEs were always imported, right? Because there was this view, guys can't compete. So when COVID hit and we couldn't access products, the Department of Trade, Industry and Competition put in place measures to support local, companies. And lo and behold, a number of companies came up making masks and, face shields and gloves and, these hazmat suits and this and that. And what they discovered is that some of them were actually cheaper than what we had been importing, right? And the quality was no less, was not inferior to what we've been importing. On the PCR platforms and the ventilators, I mean, the National Ventilator Project produced some champions. One of the companies actually is associated with us. We've got the global commercialization rights for their product. It's as good a non-invasive ventilator as anything that you'll find from Philips or Respironics and this and that. So that capability was always there. The perception around the ability to compete on price is what kept this support away. And COVID has shown that guys can compete locally. So I think on the whole, my sense is there's been a seismic shift and there's more support for local manufacturers. But again, as I said a few minutes ago, I'm hoping that this is something that will stay and it will not just we will not just default to the pre-COVID positions once things, quote unquote, return to normal.
Right. Yes, I think this is significant, what we learn out of this and how we take it ahead for the years to come.
Yeah.
Excellent. I'm really conscious of the time. We are running out of time, and I'd like to ask the participants one last chance. We could take one or two more questions, and then I'd like to move towards the closing of the session. We have one more question. It says GMB of WHO and donor-funded program have significantly contributed to the destruction of the local pharma subsector, for example, in Zimbabwe. What can government practically do to turn around this sort of nightmare?
Yeah, so I think the Zimbabwe case, the Varichem case specifically, is a very sad one because, prior to the advent of the funded, or let me say donor monies coming in, Varichem was basically carrying the treatment program in Zimbabwe. People were healthy, and of course, Varichem went on then to get WHO pre-qualification. The problem is because of the limited scale, they couldn't compete on price with companies from India. And of course, they didn't get support, which leads me back to the point I made that global funders and the global public healthcare community, especially in the post-COVID world, really need to rethink the way they do aid. The only good aid is aid that works itself out of a job. We need to find mechanisms that make it easier for African manufacturers to not only be able to supply, but to build and develop the competitiveness. So what can governments do, and what can continental organizations like AUC and NEPA do? They need to lobby hard. They really need to lobby hard to say, carve aside a portion of what you fund for local manufacturers. You have a number of countries that have done that successfully. If you're going to give aid to the Ethiopian government, they'll tell you this thing of having a report for PEPFAR and a report for UNDP and a report for UNICEF, and this and that doesn't work. 1, 2, we cover out 25% of what you buy for local manufacturers, right? And if you want the report, one government, one account, one report. Our governments need to have the fortitude to lobby hard for local companies, but also the fortitude to say, you are going to assist me, but you have to assist me on my terms. You can't import 90% of what you use, because if anything interrupts that importation, it means the government is left with a problem they cannot solve. So I think they need to really start having these hard discussions with global funders, with donor governments, and saying, COVID has taught us a lesson. We need to build local capacity. And if you don't, and I say this easily because I'm not in government and I'm not running any country, but if the global community doesn't want to help, I think some governments need to step up and say, thank you, but no thanks, we will do it our own way. It's easy to say when you're not, of course, in a position of authority, whatever, but I really feel that the aid that we have had so far has been detrimental. And as I say, we need to remind people who give aid that the only good aid is aid that works itself out of a job. And what you have seen so far is aid that builds dependency, perpetual dependency, and Africa doesn't need that, and certainly no country, no continent requires that.
Definitely, definitely. I think this is a really important message that I think this also gives UNIDO the next set of projects that we may want to take on the continent in terms of helping the local industrial building actually to start the manufacturing locally, and this is going to be one significant contribution from UNIDO that we can look to do on the continent. Thank you so much, Dr. Skhu. I understand we are running out of time. I would really sincerely thank you for your time and your contribution in the today's discussion. I would also like to thank all our participants for making it so interesting, asking some really important questions. And thank you so much, Hassan and the UNIDO Staff Council, for giving me this opportunity for handling this session. I hand over now to Hassan for closing remarks. Thank you.
Thank you very much, Shilpa. You did very well. Dr. Ngozwana, so definitely there's a click and I cannot really pronounce it, but thank you very much for the enlightenment that you have done. And also I would like to thank all our colleagues who are here. And it's what has been said. I cannot summarize that because it's not my field, but I can say 2 or 3 things about COVID. COVID brought all the world to the knee. All the world, all the continents, they were at the same level. So for us in Africa to look forward and improve our industry, I'm sure UNIDO has that capacity. I fully understand also from some of my colleagues, which I don't have the full knowledge, but I believe that UNIDO, they started to do something about the health industry initiatives. I'm sure we will see the fingerprints of UNIDO somehow in the future, not only in Africa, but around the world. And in the end, I would like to thank you all for your time and for your interest. And we'll see you next time in our next Eminent Speaker Series. I would like to thank again Shilpa and Dr. Skhu for the time. And yeah, I wish you a lovely evening. All right. Thank you very much.
Thank you so much
Thank
for
you
the
so much.
invitation.
Yeah, thank you.
Thanks,
Okay.
Hassan.
Thank you.
Thank you. Thank you, Alice.
Thank
Bye-bye.
you.
Thank you.
Thank you.
Thank you very much.
Thank you.